My role now is that I'm co-lead for the faculties, all faculties network within the DCP. And that really involves bringing faculties together and all of the faculties in relation to the DCP and the BPS strategy going forward. We know that there have been quite a lot of turmoil coming from the death of George Floyd, the way he died, the way he gasped for a breath, and the way he said, "I can't breathe." It has brought a lot of pain, hurt, anguish, and hopelessness in many. And of course, workplaces are not exempted and they have been impacted. So this has emerged across a number of forums, including the Wellbeing forums, where people have been talking about their own anguish, but also their own sense of helplessness, both white and black, feeling somewhat frozen and really wanting to have some kind of a shift in the system where we could address societal ruptures and aftermaths of across class, social, and racial groups in a way which isn't just really dressing it up a bit. And one thing which was said very clearly a number of times that racism, discrimination, and inequalities do thrive in silence. Uh, but staying quiet is not an option for us anymore. So, how do we speak about it in a manner which is open and authentic? We can't really separate this from the wider issues around stigma, discrimination, and structural racism. Uh, this has been very clearly highlighted in the work which myself and my colleagues have been doing, and some of the listening and engagement events we have been running. People have highlighted that there are misgivings in our own profession. The message has been very clear that we need to put our own house in order. We need to engage with much wider context of entrenched inequalities and structural racism if we want to make a difference. This would include considering what part we have played in keeping the status quo, what we can do individually and collectively in our role in organizations and institutions. And as I said previously, that silence is no longer an option. From my own perspective and what I've been hearing from people is that it's really important to connect up and talk to each other about diversity, inclusion, and what it means for each one of us. Be mindful of what impact we might be having on others, knowingly, unknowingly, consciously, unconsciously. And we need to ask whether we all have the required vocabulary and confidence to do this, because there's also mistrust in the system, more so in the community groups who are really impacted, but there's a great deal of anguish out there. We have to change the status quo and challenge the denial in our own system and to acknowledge that this is not going to be easy. It's important for us to consider how we can have psychological leadership and influence, which can be continuing here onwards after COVID, and which would include having clear structures which go across senior levels, including representation at the board level to influence. There has been a conversation about psychological professionals playing a vital part around governance and how their input can really inform policy and can really inform a running of an organization. COVID has offered and opened up many opportunities for us to have a rethink how we get to the position of influence and engage and work closely with communities we are serving. And this would require us to set out new ways of collaboration across organizations, professional representational systems, working closely with expert by experience communities we are serving. We need to work alongside others. Professionals, which is really linking up with other professional bodies too. So that it's not a journey alone, it's to work alongside others, including communities, which I think is really important to stock take and then move forward.